The Core 360 belt is the best aid to train the abdominal wall. The Core 360 is a patent-pending, first-of-its-kind training belt that helps you move, breathe, and perform better. We use the Core 360 belt with almost every patient at Winchester Spine and Sport. The biofeedback is second to none, and it's an amazing way to teach proper respiration and can be even used during higher-level movements in the gym. Teaching proper respiration is about as fun as a rash, but with the Core 360 belt, you take all the headaches away. Visit core360belt.com and use the code GESTALT for 10% off all belts. Ohmtrack sensors not included. Again, visit core360, core360belt.com and use the code GESTALT for 10% off. Enjoy the episode. All right, everyone. Welcome to another episode of the Gestalt Education Show. We're round two of our tour of Caesars with our guests in our little podcast studio, Brett. So, Jason, thanks for being here. So, Jason Hulme, Hendersonville.
Yep.
Okay, Hendersonville, Tennessee, which is just outside of Nashville, is where you practice, and then you're here speaking at Parker as well. So, what was your topic?
My topic is on building your team to be all inclusive and to be a coherent team that can also do rehab. So It's a big rehab focus, takes all the principles that we come from, our background, et cetera. But how do you apply that to have, say, the CAs want to help level up the doc because maybe the doc has resistance. All right, what are the strategies to bring that along? If you're the doc and you need to bring along CAs, how can you do that? And you do that through your culture and, defining your mission and all those things. So bringing all that together.
Culture is something I've heard you talk about too, and Brett's that's a big topic of Brett's. We talk about that all the time with the office and everything. But where did this little obsession, it almost feels like, with culture and management and that kind of stuff? Has that always been your background, or did it kind of come out of somewhere different?
No, I think where we realized that was going to be crucially important was just in our growth early on in practice. Mm-hmm. We had a lot of things go very interesting early on. So when we opened, let's just get to the background real quick.
Yeah.
I come from the Church of Brett Winchester, right? So everybody did at Logan at the time. I mean, there's Brett, powerful, great speaker, great content, just exposing us to great rehab principles incredibly early. And so everything that we would experience at MPI, and that was like our safe haven for those that got into the profession to be able to help athletes. I don't know anybody else at the time that was talking about how do we effectively rehab and strengthen athletes and do those things. And Brett was hitting that just unbelievably. And so all those things, what was amazing about Brett and everyone that knows you is that when you take a course with him, the confidence just, you pick up the material, you see how to apply it, and you're like, let's effing run it. All right, I got this. So you fast forward, you graduate, you're like, of course I'm opening my own place. I mean, there's is there a second option?
Yeah.
What else would I do? So you open your own place and you're for sure, everybody's going to refer to you. You're going to do everything
People
right.
are knocking down your damn door.
Unbelievable.
Yeah.
Right?
Back at the Brinks truck.
Definitely going to happen. Definitely going to happen. And then what happens is just the reality starts to hit you really fast. But one of the things we got very fortunate with is we took a prominent ortho in the region lunch really early on. And what was wild is he trusted us right away to send in a post-op case. And I was like, oh my gosh. I'm like, okay. So I'm calling Brett instantly okay, how do I do this?
Yeah.
I thought I had this and maybe I don't. And then I was just, calling him every night, hey, here's something about next visit. Here's where I'm at. And without his leadership and mentorship on that, I don't know, where I'd be.
Do you remember when you were an intern and then you got a call? I forget what.
Oh my God!
And you're I'm done.
You're going there. You're going there. Okay, I will never forget this. So I'm out at Brett's office, and the cool thing about this whole experience is that early in Tri 3, Logan, the school, just where I was at, it wasn't what I was thinking it was going to be. Right? I got into this because of a sports injury. I got hurt, and I went to a chiro. Treated me once. I could breathe. I was better. And I'm like, dude, chiros are amazing. They fix you in one visit. You're better. Right. And so get to Logan and then you go through the chiropractic history classes. And I'm like, when are you going to tell me how to fix somebody in one visit? This is not what I'm here for. What is all this? And then got to see Brett and be like, oh, bigger picture. All right, rehab, these other aspects. And that's what really, helped draw that all back together. But without that type of information, without, where he was coming from on it, it's just different. But anyway, so I'd already been out there from Tri3 on. Like, he just said, look, get through your classes, but just get up here. Just come to the office.
And you know how bad I am with technology. Oh, yeah. Well, he's a savant with technology. I mean, this guy can do anything. So we were fast friends immediately because of that. Many times I'd start a presentation, I'm like, I don't know what I'm doing.
So that's how we met. That's how we met. Tri2 is right at the course. Everybody's like, this guy is like the guy. You've got to see him in course. I'm like, okay, because I'd seen Mark present. Mark King present as Tri1, but then Tri2, he was doing the class, and we showed up there like, oh, he's the man. It's going to be amazing. And we sit down. I'm like, dude, I'm ready. He's going to walk in this room and it's just going to be like fireworks. And instead you see deer in headlights staring at his computer like this for like 4 straight minutes. And I'm like, this dude's really breaking down right now.
This is not good.
I don't know who he is.
Never meet your heroes, right?
And I was sitting there like, I don't know what the problem is, but I just know it's going to take 5 seconds to fix it. Like, nobody has to look at a computer this hard. So I just said, all right, F it, I'm going to walk up there. So I just walk up there and I'm like, what's the issue? Oh, do this. And then he's like, okay, so we're going. And then afterwards he's like, hey, nice save. I'm like, thanks. And I'm like, yeah, sweet, what's up? Yeah. And then anyway, he's like, hey, so I have these other 37 problems. Do you know anything about these? And then at Baxter Crossings, here he comes, like 4 nights a week. He's like, hey, Jason, hey, oh man, you know how to get this too? Like, dude, this is amazing. But it went both ways, right? So,
all right, get back to the freaking question. Culture. Where did you start to pick that up? I know that you had some struggles early on, and then you started to invest more into that. But then now what you've done is kind of built. I mean, it's literally your office is unlike any other one in the world. So I think number one, talk about that, and then 2, talk about how you maintain culture with as many kind of moving parts as you got going.
Yeah. So when we started early with the rehab and we started getting in with different providers because the quality results we were getting, we actually started getting a lot of referrals. So it started really slow, but then once it hit, it kind of just hit. Like it became a big change in the community. And so the problem with that is any of y'all, you know how many we can fit on a schedule, like as one provider, if you're having 10 new patients a week that are very complex cases, I mean, you're pretty maxed fast. I mean, it is like you're really drowning. And so we realized what happened as soon as we got to a certain number threshold of patients, the quality was dipping. Like I couldn't keep up.
Scalability
was bad. And so that's where it all stepped in. It's that it was like, once we realized that, I'm like, ooh, how I'm approaching this, there's no way to scale this. Like I'm accidentally building a guru practice, and that's never my goal. Right. I didn't want it to be come see Jason. Like that doesn't make any sense. So I can't help enough. Our mission is to help as many people in the community as possible. Can't do that as one person. We have 70,000 people in our small town. We got 1.2 million 15 minutes away. One dude can't do very much, So we knew we had to have a team, and that's where my wife comes in is unbelievably instrumental, is because she can see the big picture and say, all right, like you have this vision for whatever this is you want. And she's like, all right, here's the, long, slow, deep thinking on how to actually do the thing. And so that's where we saw the vision. We knew what we wanted. And we realized real quick, once you got down to like bare bones, what we really need,
systems,
it has to be systems.
Yeah. And then, so I was telling you the other day in the gym, we had Gray on. And so we spent 3 days in the backwoods of Virginia with that human being. And I mean, he's special. He's just a great human being. But anyways, you got mesmerized by SFMA, the whole FMS system. So, and I'm assuming because it was basically a system that allowed you to do your thing.
I'd had a conversation with Greg Rose at TPI back in 07 or 08, whenever we took that, because a couple of the guys in my class were big golfers. And anyway, so they said it was great. So we went, and it was really great. I had a conversation with them. I said, man, I love the idea of these systems, but me running this on every patient, I'm not a golfer myself, and I don't plan to play a lot of golf. It seems weird for me to use a lot of golf screens, right? But this is great. I love this type of system. And he said, hey, the best thing we've got going actually is our medical class. And that's called the SFMA, and it's our level 2 TPI. And I said, okay. But then I hadn't been in practice yet, though, right? So I didn't know what you didn't know what you meant. Didn't know. So once we hit our scale issues, the quality thing started to dip. It was like, this is not this isn't it. So we saw that Greg was doing a course down at Andrew's clinic, at James Andrews' place. And so we went down there, Kevin Wilkes down there and took the course. And I was like, this is what I was missing. Like this fits our scale. I can communicate this fast. We can have assistants that can communicate this. We can find out real quick, what are the 3 things mobility wise that we're treating? And we know no matter who walks in the room, they know what mobility thing we're working on. And now we can communicate so quickly of building their plan backwards from where we're trying to get them. Where are they now? All right. How do we make that happen in the time span? And now we can all read each other's mind, so it's crucial from that.
What all I mean, I know the obvious ones as far as like MPI and other things. What's in your toolbox? Like, what treatment systems are you guys utilizing at your office?
I think the systems piece of that is, it depends on how scale you want to really get to, right? So I come from all the principles of everything we did at MPI,
right.
Everything that early DNS, all of those things are instrumental in all the philosophy of what
ART,
we do.
ART,
all of that.
Yeah. And you dry needle, I think, too.
For sure.
And you've taken a Mulligan course. I mean, I think
a bunch of those.
Yeah.
Just like anybody. You jump around, you want everything. Like, what's the best I can take from each one? Because every time you're going to see a case that like needs something else, right? But what is so nice about using the SMA as our backing for everything that we do as a team is that we know where we're going right away, right? Like there's no confusion amongst anybody in the room.
Well, you're speaking the same language. It's kind of like your operating system,
exactly.
if you will.
Exactly. Yeah.
Love it. And then I just forgot my question. I just blanked for a second. So then on the scalability of talking the same language, how do you communicate second to second or, patient to patient? How does that look as far as EHR, or how are you passing the notes to each other?
Well, one thing I think everybody should pay attention here is that's listening to this is you guys have automated so much to where like when you walk into a patient, I'm assuming it's the same way. You've already like had things videoed and so that's basically I think probably what the moment you had was, what are the things that I actually need to be doing with the patient? And then when you realize that, you realize it's actually not that much, where you could be having people around you doing a lot of the stuff.
For sure. I mean, that's what we realize is that they're coming to Active Spine and Joint Center. Like they're not coming to see Jason, right? So no matter what, with the providers that we have 3 unbelievable docs right now. And it doesn't matter who you see, like the team's going to be on it. Our assistants are so great at pulling off the SFMA. They're starting recording that right away. We're walking into the room knowing what the mobility issue is, what the stability thing is, what their history is already. And then we come in and still take the full thorough history, do whatever neuro we need to do, whatever MDT we need to do, et cetera, et cetera. But at the same time, like the system is pretty black and white. We have great things that Cassie's put together as far as how we, put those in. But when we walk in there, we get the iPad, we have the forms filled out of exactly how they did. Like we have the info and the team can run.
Yeah. So, and then it all is on a digital copy that you in their EHR record, I assume. Then it just, it kind of runs.
So exactly. Yeah. So we just use the SMA verbiage and we have a section that's just like, here's the big mobility things. Here's the stability things. Here's where we're going. So we just have our big 6-8 questions and here's all the answers. And literally in 2 minutes, you can know it, where that patient's at and where they're going. But the big thing for us is that, we still do come together on Wednesdays, for 3 hours of team training where everybody's training each other. And then we do like a grand rounds on Mondays for 2 hours where we go over every case, where they're at. Because so for example, like right now we have the whole spectrum of cases. Like right now, one of my dear friends was with COVID was in the ICU for 130 days, on a ventilator for 110 days. Wow. And he's now out and we're rehabbing him back, getting his mobility back, started with some of our DNS stuff, working with our breathing, because that's the level that he needs that initially just to be able to breathe and get his oxygen back up. Well, we have that. And then we have a 6'11" pro basketball player that we're rehabbing 18 hours a week, like to get back after an ACL tear. So like we literally have the entire spectrum. And when you have that, like you still got to come together and say, look, what's our initial goals? Where are we? Hey, how'd they do this week? And we have certain systems to say, we need to talk about this one, right? And like, these are fine. Like,
and be honest with yourself. Like,
for sure.
Because not every case, of course, goes exactly the way we want. So, for sure. There's so many learning moments within the team of docs. And,
for sure. Yeah. It's awesome.
Yeah. So, I mean, I think that's a good message because I learned this lesson the hard way myself. we weren't meeting as a team like we were early on in my practice. And then once we started having like staff meetings and doctor meetings, I feel like that changed the culture immediately.
Yeah.
I think that's really, because everyone's busy. No one wants another meeting, but I do think that's like a critical thing to have plugged in.
Absolutely. I mean, the first time, when we really started doing that, what was really great was as soon as Cassie got up there and would show her expertise on all the different system basis, or like she wrote a software for our office, actually for the back end for patient management. And like the way that she puts that out and able to communicate it, like watching that, like you just see the whole team elevate. When you see one of our head assistants, Mallory or Sarah, when they're training, like, hey, no, this is how we run the SFMA. Here's how we get this top tier recorded in 2.5 minutes. Here's how we do X, Y, Z. When you watch them, there's no way anybody in that room isn't leaving just incredibly hyped for what we do every day, because you get to see the expertise of everybody.
Are those video files like kept in their file, or is it just like you use it one time and you're done with it? How does that all work?
No, so it's all backed up in the cloud, HIPAA compliant, with an app called Spark Motion.
Okay.
We use.
Yep. And then do you
MoveCon 15 is the discount code.
There you go.
That.
Yeah.
That's
I was going to get you there.
Yeah. You get a free month. MoveCon 15. Yeah.
I love it. No free shout outs.
Yeah. Do you, I don't
I'll
even
Venmo you
know. I don't know where I was after that.
I mean,
Yeah, but the whole idea is that we do have the videos and we reference them
back
always.
with the video.
For sure.
I bet that's pretty powerful, right?
Huge.
Yeah.
Huge. Because you got to remember, like, we just had a case. This was the last case I saw before we headed here to speak in Vegas. We had an individual she was killing a spider, and literally with a shoe, and she hurt her shoulder. And when that happened, anyway, turned into frozen shoulder. Well, she came in initially, and she had a specific goal of being able to, go on this cruise, do the things that she wanted to do, and she was miserable,
spider.
right? Yeah, but
just burn the house down. Jeez.
Yeah.
But the reality is, so she came in, had no external rotation, had all the signs and all the limitations. 4 weeks later, her mobility, she's passing, SMA shoulder patterns, and she's like, oh, but it still hurts at night. And I'm like, honey, I know it hurts at night. That's the diagnosis. I'm with you. We're going to do everything we can to get that right. But do you know where you were literally 3 to 4 weeks ago? And then we put it on the TV, and she sees it, and she's like, oh, I'm doing way better. Right. And so sometimes they're living with it every minute, every day, and don't necessarily know, what those snapshots really are and like what clinically can matter. So them seeing that initial exam, seeing it at every re-exam. So every 30 days we show them, like, here's where you were, here's where you're at now. Here's your current measurements. Here's where we got to get to. Like, let's get on the grind.
And is the video basically capturing the top tier SFMA? Is that what it's doing?
We do top tier breakouts and key things that we need. So like if it's an ACL case and we're doing lateral hop tests or we're doing triple hop tests, like we still want to record the mechanics to play it back in slow-mo. So we can show them like, you're off. Like, I know it felt good. I know your jump distance was equal, but look at this. This is different. If I add a head spin with this and I give it a little vestibular, you lose control there. But you're great on your non-surgical side. Like, those things matter that you can't necessarily pick up just by using the normative data of the distance that they jumped.
And are you a 100% purist at SFMA, or have you modified that system for your own needs?
I don't even know how to answer that question. I mean, yes, we don't change the SFMA, if that makes sense. Like, that's our standard operating procedure. But however, like, I think the better question is, in a visit, like, are we doing the whole SFMA every time? And the answer to that is no, right? So we're going to take them through the top tier. We're going to find the patterns that matter the most that we need to fix for their activity, right? Because when we think about it from a regional interdependence approach, a lot of times we're trying to just restore those mobility areas for the elastomer effect, right? Like to deload some area, et cetera. So the whole idea is if we know the pattern we're working on, we're going to run that. Like each session, we'll say, hey, just show me extension real quick. All right, cool. Let me see this breakout real quick. Awesome. And I'm soft tissue in there or whatever anyway. So it's not like it's, this, you have to do the whole thing. I think a lot of people don't, if they don't use it consistently, it's hard to understand like how you can do that. But what will happen is at re-exam, heck yeah, we're redoing everything. We'll break out everything if we need to. And it'll blow you away by just fixing one pattern, how 3 others will clean up.
Well, we talk a lot about like technique fusions, which basically means you're like blending, 2 technique systems together.
For sure.
And I remember with me being on the board at MPI, we're like, well, a lot of our students were, getting involved with SFMA, and they were saying like how like perfect that blend was. Like sometimes we also talk about like in MDT and MPI principles blend really well together. Sure. I think MPI and SFMA also blends really well.
Yeah, without question. I mean, I think what's so beautiful about the entire functional movement system as a whole is what they've done is unbelievable at mapping from the most disabled impairment all the way to the highest level of performance. It's just the entire picture. Mm-hmm. And so we may be working on one sliver snapshot at a time, but we now, that's where, when you said, the SFMA brought me something, the FMS gave me something that I needed, it really opened my eyes to, here's the entire picture. Here's how high level of analysis we could go there. But let's not forget, we only get them for X number of weeks or X number of sessions because the current insurance models, et cetera. So we need to know where we're going. We got to know where they're at. And we got to be real about, are we doing every role of this? Or are we having an ally in the community pick up on the back end? But if you don't have that full spectrum of where we're going and you don't build that plan backwards, you're just going to struggle, because how we're trained so often is assess them, find them. Awesome. Let's start at insert exercise. Awesome. Well, now we're just going to keep progressing one step in front of the other, this linear based progression. And the problem with that is that's unrealistic, right? So often that unloads a patient or deloads them so bad that they can't get back to their sport at the timeline that we need them to.
Well, and we asked Gray too, point blank. We said, what are the limitations in your system? Basically is the question we asked. What do you think, what's missing in there that you've had to like kind of go outside and kind of fill those gaps?
I think that's a great question, because, when I came to it, the first thing I was seeing it as is like, what is this company? Like, what am I getting from it? I kept wanting to go back to that same like student mentality of, okay, that's great and all, but now like, what's the best fix for blank?
Right.
Like, what's the best thing for blank? Right. And that was my whole thing. It wasn't, wait a minute, this is a diagnostics company.
Right.
So this company, the thing that they have done better than, in my opinion, anybody in the world is say, we're going to put together systems that are reproducible, that at every level of sport, at every level of disability or impairment, like here's the assessment. And so it's not a treatment organization. Does that make sense?
Yeah.
They're amazing at assessing, but you plug in your expertise to fix the thing.
I mean, I say this on every stage that I'm on. It's like, I feel like no one is making people look globally more than Gray Cook, because it's forcing you to, because everybody wants to say that they're treating globally and things like that. But at the end of the day, a lot of times people are not. But like that system basically makes you do that.
For sure. And that's what it holds us honest to it. Right. And it's been something that's been so great for us. And the patients just, they get it. I mean, we don't educate about it. They just experience it and get it. They're like, oh, we're working on the hip now. It's like, yeah, we're trying to deload this area. Oh, yeah, cool.
You've also really kind of became an expert in the world of chiropractic in getting medical referrals. So, I mean, a lot of our listeners are interested in that. So what would you say are some quick hitters on, what they need to do to be able to do that and how you've done that?
Show them and relationships.
Yeah.
You got to show them.
Right.
And that's because the training is so different. Our colleagues, our medical colleagues, whether they're primary care, ortho, pain management, et cetera, at the end of the day, we can talk about it all the time and they can rap about it and they know their side. But like, we really don't, unless you hang out with them or they hang out with you, nobody has any idea what each other does. Right. And so for them, the biggest thing is always like, oh, so we heard from so-and-so that, man, you really helped them. What the heck did you do with them? In our situation, it's very fortunate because we're like, that's a great question. I'm glad you asked. Here's where they started. Here's their top tier. Here's where it's at the end. Like, and we can just show them. Like,
and I can 100% verify that Jason Hulme does this, because you sent me a radiologist, and him and his wife, they send me so many patients. Yeah. But it's interesting. This guy,
he's amazing. Yeah, I love him.
And
super smart.
So yeah, but like he really understands the model, and like what I take away from that is like, there is no way I'm educating my patients to the level that Jason is, because this guy basically just like, it's like talking to you almost. So anyways, I think that's it's always good to see people that aren't only talking the talk, they're also walking the walk.
For sure.
Yeah, and then what about is there any hesitancies that you had when you started creating those referrals, or as far as maybe do you do anything different that versus just a regular referral? Or
what are the barriers?
Yeah.
That's a good question. I just been doing it though.
Yeah,
it's meet them. It's no different than any other relationship.
Yeah.
I mean, I think the biggest thing I messed up early on, because I accidentally burned some bridges early on, but from a misunderstanding of the whole thing. I just remember in school there was a buzz about, man, you know what? Primary care physicians and orthos, like they don't know what to do with all these patients. Yeah. They have them and they don't have a way to manage it. Like they're begging for what you offer. Yeah. And I think I handled that not great a few times of like, man, hey, I'm here. Like, I'm ready to help whoever. You know? Yeah. Are you so glad to meet me or what? And that was not how that should go. Did not. But the key always came back to like, wait a minute. Oh, you do have systems for this. This is your algorithm. This is how you play it. Oh, you do have this solved, because in your mind there's 3 avenues. Yeah. Right. And you're going to pick one of those 3 and you're attacking, and that's your way forward. But now we've got to say like, hey, we're an option here that is either that 4th or, we want to be that 3rd, option for you. But you got to be real. A lot of these offices, they're owned by a hospital and they have referral sources that mandate that they stay inside. Mm-hmm. And if that's the case, I would say that it's still extremely valuable to be that doc that sees them and says, look, I understand that you're going to refer in-house to your PTs. You'll have great PTs here. You're going to keep that in-house. I fully understand that. But, there is a limitation in the insurance model now, and they're going to run out of PT visits. But they didn't run out of chiro visits. And we're going to give them, world-class rehabilitation, and we're here for you. So those people in the gap, they come to you and, they're like, hey, I finished my sessions PT. I'm out of benefits. I can't afford $240 a visit, right? Oh, those are who we're looking for.
Yeah. Right.
And so that avenue alone, I mean, there's probably 40 or 50 cars I can talk about that I've helped them build their business by simply just being effective at doing that. Mm-hmm. Does that make sense? Fill that gap.
The number's pretty crazy. How many medical referrals do you get a month, you say?
It depends. Through COVID, it got a little weird, et cetera. But I mean, it's well over 40.
Right.
That's our constant vibe, depending on the time of year, et cetera.
I think it's a good point too, because initially, like you're kind of talking, if you do have like let's say a post ACL, and you can catch them up on the back end of PT, we have so much more benefit there than in the beginning. I don't want to do wound care. I don't want to rewrap. Sure. We can do it, yes, but that's not what I want. We don't want to grind through range of motion, but being able to do that back end stuff, that's the more rewarding stuff.
And I think that's where this profession always still comes back, and to me is always going to be the best, because if you understand the full spectrum, you can pick whichever slice you want. Sure. But never forget, we are physicians. It is our job to manage the whole case. So if we're not going to do that thing, we better pick the right place for them to be, and they better be in world-class hands when they do it, and then you're there when they need you. And so if that's what you want, you don't want to do that early mobility, awesome. And you just let them know, like, hey, Ms. Jones, when you hit 0 degrees extension, when your quad's back, when you now are getting back to these simple functional things, we're your people. We're going to take this and run with it, because your visits are going to give you 20 with PT. Well, baby, we got to get you to 9 months here strong and get that quad back. It's going to take a couple of years. So
I think too, that's what people are really looking for. And like Western medicine doesn't do this very well, which is you basically need a case manager. You need somebody who's basically directing like who you need to see. And I feel like medicine lets people down so much there, and I feel like a good portion of my day is basically doing that for people.
For sure.
Yeah, because for sure. And I think like chiropractors, especially moving forward, we're in such a good position to be able to do this, because it doesn't make sense. I always talk about in baseball. So in professional baseball, 10% of all reported injuries require an orthopedic surgeon. So sometimes it doesn't make sense that they're the first. And they don't want to be that. Because it's wasting their time, and
Sure.
So why would you not start with somebody who can take off the low hanging fruit? That's a 90%. It just it makes sense.
Absolutely.
The problem is though, like in our profession, others, not the people who are listening on this, but like sometimes we're not great at being able to do that for people. You know, like we don't have the connections or we don't, you know. So, I mean, I think we serve a huge purpose for humanity. It's like being able to kind of direct traffic.
Without question. And that's the thing is there's just not enough of us, right?
Right.
Like you need more. So if you're going to shift the culture, which is something, you know, of the world, like, and especially in America, we got to have numbers. We got to have more elite providers. And that's where what everything NPI is doing, everything DNS is doing. Like these are crucial. Everything that FMS is bringing, like the whole picture, tying all the professions together.
Right.
God, when you take these and you put them together, I mean, it's just
It's
hard
powerful.
to not.
You're forced to.
It's hard not to get really excited every day. You know.
Yeah.
Absolutely. Now you also wear some other hats. So you teach, but you also are on the board for the Tennessee Chiropractic Association, and so
Not the TCA.
Okay,
so,
I'm sorry.
Yep, it's so the Tennessee Board of Chiropractic Examiners.
Thank you.
So that's
Got
that's an appointment by the governor. So that's different. That's a regulatory role.
Gotcha.
Right.
Yeah.
Are
And
you
so
an elected official?
take us through what duties you have and kind of what have you learned about, I don't know, the back end of chiropractic by doing that?
Yeah, I think there's a lot of things I've learned from that. You know, it's not something that I'd had any experience with or knew a whole lot of people that had a lot of experience with. There's one provider that I looked up to in Tennessee and he had done that. And I felt like, you know, at some point in my career, it might be worth being able to serve in that way. But one of the most rewarding things about it has been when you are a sitting board member, the NBCE, so our National Board of Chiropractic Examiners, NBCE will then, they have delegates that will come together to help work on the test exam. So like part 3, part 4, and you do a thing called standard setting where you can be asked to come as an expert to NBCE and, you know, set the cut score or help write test questions or help remove test questions. And, you know, I've done that 3 or 4 times now. And every time it's been massively rewarding to see the back end, the stats of how students are doing and be able to shift the culture from, hey, we need more questions related to XYZ. Let's get those in there and let's start building that process, because not only do we like to, you know, influence the profession in the world from the ground up, like we do in practice every day and helping teach, et cetera, but it's also kind of nice if you also start bringing it one step at a time from top down.
Well, I mean, you talk about a disconnect. I mean, I always say, like, sometimes, like, your chiropractic education looks so different than what a typical day looks like in chiropractic practice.
For sure.
You know, so that's kind of a weird dichotomy, really. You know, like, you would think that it would look a little bit more like what you're. For sure. So, I mean, it sounds like your boots on the ground kind of maybe being able to change some of those things. And
it's been nice. It's very, you know, I will say when you spend time at NBC and you spend time with a psychometrician and you look at how they actually do these exams, it actually makes you really proud of the process and things that we're doing. I mean, it is a very well scientifically studied exam and executed exam. So it's really impressive, actually.
Yeah.
It's pretty cool too. I mean, you've just done so much for the profession. We love you. We're so proud of you. I've looked up to you since, you know, I saw you early on in my career. But so then what's next? I mean, we kind of talked off air about, you know, next for the practice, maybe adding some more docs. And then what do you think is next as far as chiropractic? Let's get a little philosophical there.
Whew, that one's always so hard, man, because I've been struggling with that question since I came out of school. And, you know, what's always worked for me is that, you know, something I learned from Brett early on is like, every day you're going to approach the day and you're going to do the best that you can do that day. And you're always going to kind of have a direction you're going. But for me, setting my sights on like a 5-year plan and those things, I never really could connect with those. And I never felt like I could connect the dots. Maybe I have too much ADD or whatever, but I'm like, I can't get there, but I know the direction we want to go. I can bounce it and say, hey, Cassie, my wife, how do here's where I'm thinking. And then she can be like, okay, moron, here's how you do this. You know, like, here's steps. A, B, C, D, and stay forward. So for me, it's, you know, it's always the one thing at a time. But for the profession, I think just with social media, with all these ways to podcasts being so popular of a medium now, you know, people have access to Brett whenever now, right? I mean, come on, like this used to be a very regional specific thing. You know, we were very honored at Logan to be able to have access to great resources like that. And now it's like, no matter where you are, you can have access, right? And so I think things like that are going to allow some of these other areas that maybe don't have as rehab-oriented providers, the content's there now, right? Like we can all get it. You just got to put in the grind and want it.
Let's do it. Yeah, you got to show up. Yeah, you got to show up. You got to apply it. And,
half the battle.
Yeah. I mean, That's a good. So then
I remember Mark saying too, so at MPI, obviously you know, when we started the Sports Summit, you were one of the early people that we were utilizing there. And we had never seen you present or anything like that. And I remember the first one, the feedback was this. Everyone's like, Jason Hulme was unbelievable. So you kind of like developed your own stick and like your presenting style and things like that. So now you've like got a whole different thing going there. So yeah, where's that all going, do you think?
Yeah, I don't really know. I mean, if someone wants, you know, to learn more about how to do these things, like we want to be there to help share.
Yeah.
Like the same thing that you did for us. Like you took all of your expertise from all your mentors and put it together and said, but here's the thing that we're doing a little bit different, right? Like here's how we're
one of your gold medals is like you're kind of in a fun way, self-deprecating. Like you're more than happy to kind of say, well, this is what I've struggled with. And like, and I think that's why people have really kind of like gravitated because everybody, you know, everybody's got the same problems, you know? So yeah, I think I would say that's one of your gold medals.
I think that's what does help is that I don't have too many issues talking about our failures. You know, I mean, there's been a lot of them, but every one, I mean, we've leveled up 5-10 times from every one of them, right? Like if we look back at our journey, there are like 6 or 7, like, oh gosh, here we are. Like this is a miserable moment. And then, you know, cry in the shower for a bit, wake up, drink a little, and then have a conversation.
Drink beer in the shower.
Yeah.
We've all been there.
And then Cassie's like, no, here's the way forward. Like, here's how we're going to do this. And I'm like, okay, yeah, let's go.
Yeah, refocus.
For sure.
Yeah.
You know, we had a huge one in our region where it was such a culture shock. So rehab was reimbursed one way for the first 7-8 years of practice. And then a major prominent payer came in and said, we're going to cut your fee 60% across the board for everybody.
Wow.
And so the model that we were running needed to get even more efficient 7 years in. Like we thought we were killing it. And then we were like, turns out we're going to be paying patients to come in now. So,
that makes sense.
This is not so great. So now we had to sit down and like, how do we make this even more efficient? And that's where we learned like, man, we have some superstars that are chiropractic assistants. Like RCAs these are unbelievably talented people and they want to influence and they want to help and get hands-on. And we just realized, what are we doing? Like, let's just level each other up.
No.
And now the whole team, I mean, no matter who you see, I really so honored and proud of that team that like anybody
we have I mean a world-class one ourselves, but like a CA position, you can educate them to a level to where, I mean, we kind of jokingly say we'd put our CA up against like any of our interns or any like,
for sure,
because they get to a point where they're so good that
for sure.
I mean, they kind of just know how to treat low back pain without doing manipulation. They can't do that, but I mean, like besides that, it
would blow you away. I mean, we had our first CA that just really ran with it, and in Tennessee, it's a special license. It's called a chiropractic therapy assistant, so they can do everything basically but adjust or diagnose.
Right.
And when Sarah just started to bloom and she was just hungry for the content, knew she could help. And then Mallory, came in and she just picked up the content and is just an absolute superstar. And now we have Madison's right behind her that's just picking up everything so stinking fast. You're just like, these people, like, what an honor to work with them because what they're doing, you just feel it constantly. The patients are just, like, no matter who they're working with, they all have their own personality, their own stick, like with them, working with them. And everybody has their own connection with everybody.
Or when you have the moment where like something actually goes better without you being a part of it. Like you think it's going to be the opposite. And then you're like, wow, okay.
All the time.
That's a great moment.
Absolutely. I mean,
it's a good little humbling thing.
Yeah, for sure.
Yeah. And I was only wrecking this situation. I'm glad that I stepped away from it.
And that's what we've learned. The CAs will keep us on time. They'll be like, you're spending, like, what are you doing? Like, quit talking. Like this, none of this was productive. Yeah. This last 6 minutes, you're no different place than you were 6 minutes ago. I could already had them started and actually getting better. Like, what are you doing?
Yeah.
It's awesome. Great. Oh, well, thanks again. Thanks for sitting down with us. Appreciate you, Jason, your whole staff, Cassie, awesome. So, we're just happy to have you here. You're an old Brett Winchester intern too.
Of course.
We have a list in the office of all the old interns.
Nice.
It is crazy. So we haven't got anything on paper yet, but we have something planned.
You got to do the map. Connect the dots.
The list is,
it
is unbelievable.
Insane.
It's awesome.
And I mean, for us, the biggest thing is like you guys go on and you do things like, I mean, nothing would make me more proud than like you show up to Parker and I see your name, I see Lindsay Muma, I see Brandon Steele. Yeah. I mean, these are these are all our people. I mean, it's
100%.
just so fun to watch that. I mean, I can't even tell you how proud I am for that. So
Yeah, 100%. Never forget it. I mean, that's what, great mentorship does, right? It inspires others to say, God, well, there's got to be more. Like, how do we inspire the next generation?
Right.
So
that's
cool.
awesome.
Awesome. All right, guys. Well, I hope you enjoyed this conversation. I know I did. I can't wait to go back and listen to it again. And let's enjoy Vegas.
Let's go.
One more day,
Let's
right?
go, baby.
I love it. All right. Well, thanks again. Have a great time and rock and roll.
Oh.
I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.